Hey out there. Welcome back, all my nursing students and nursing grads. So, this is your girl, Nurse Pia, and I'm back with another NCLEX power topic. So, welcome to safety and infection control, one of the most tested NCLEX topics. I'm pretty sure you all have heard about this now. It's coming. So, safety and infection control, again, it is one of the most tested NCLEX topics. You have to master the 10 to 16% that can make or break your score. All right, so let's break it down with some visuals, hacks, and examples. Okay, guys, so standard precautions. Standard precautions apply to all patients every time. So you want to think hand hygiene, gloves when needed, and respiratory etiquette. Okay, so here we have transmission based precautions, which looks like contact, droplet, and airborne precautions. Each require different gear. So you want to remember airborne means N95 and a negative pressure room. All right. NCLEX loves this topic, guys. Donning and doffing PPE. So know your PPE order. I can't say it enough. Know your PPE order. Don with gown first, gloves last. Doff alphabetically. Gloves, goggles, gown, mask. Remember, doff alphabetically. Gloves, goggles, gown, mask. Know your PPE order. NCLEX loves this stuff. All right, this is a hot topic. Fall prevention. Fall prevention saves lives. Think call lights, bed alarms, non skid socks, and hourly rounding. Hourly rounding. Okay? Fall prevention saves lives. So you always want to think things that can help prevent the falls. All right, to all my future nurses out there, this topic is very important. Clean versus sterile. So when you're doing the NCLEX the way you want to think, medical asepsis means clean. Surgical asepsis means sterile. You don't want to touch the 1 inch border, and sterile gloves only for invasive procedures. Those are the key points to take away from this topic when you're sitting through NCLEX. If you see anything pertaining to medical asepsis, you think clean. Surgical asepsis, you think sterile. Stay away from that 1 inch border again, and sterile gloves are only for invasive procedures. Okay, hot topic, safety and error prevention. So, to prevent errors, we want to use the 6 rights of meds. We never want to recap needles. We're going to use our timeouts before any procedures, and we definitely want to do the 2 ID checks. Okay? So make sure you're thinking of all these things when we're talking safety and error prevention. NCLEX topic, fire safety, race, and pass. Know your acronyms, okay? Know your emergency acronyms. RACE, to control fires. PASS is the extinguisher like a pro. That's it. And you just got to know. Race, rescue, alarm, contain, extinguish, pass. You want to pull, aim, squeeze, and sweep. Make sure you know these. Okay, we're on to disaster triage colors. In a disaster, color codes do save lives, okay? Red is immediate, black is expectant. Know your triage tags. You must know these. All right, my future NCLEX takers, my future nurses, my future graduate nurses, we have reached the end of another quick NCLEX review topic, and today we have mastered infection control. So you've got this. Mastering infection control means fewer errors and more points on your NCLEX. So do not sleep on these topics. Get those extra points so you can make that computer shut down quicker than you need it to. Okay, so I'm here for you. Anytime you want to review something, drop a note in the chat, save, share, follow. This your girl, Nurse Pia. I'll be back with more topics on NCLEX review to prep you all and get you ready to sit and pass this test in one sitting. Have a good one.